Hi there. Today I want to introduce you to our prescribing module. This module is all about how do you safely and effectively and efficiently manage patient medication and their reviews and all the things that CQC and others look at. There's lots of different parts to this system. So I'm going to start with the prescribing overview template, which, a little bit like the others, shows you what's going on for the patient. And we've got here the med review status, which is basically they need an annual review prior to the med review. So one of the fundamental issues you may find in your practice is that things are often out of sequence. So you might get a patient booked in with you for a med review, but actually their bloods are way out of date. They need their annual review, and so there's really no point. Or it might be that the patient orders their medication, it's gone way past their review date, or even just past, and so you get a task saying, what should I do? And often the answer is very simple. It's they need their med review. They need their annual review, or they need these blood tests doing. So what one part of the system does is it directs staff what to do in that scenario. So they have this. They normally have it on their toolbar, and there's also kind of automated things to use this if they forget to do it. But this tells them what to do if a patient's gone past their review date, and it tells us why and does various things. So here we can see it's telling you issue one more script. If necessary, move the review date to today. That's if the patient's already had one issue past their allotted amount. The rationale, invite for the LTC or the annual review is due to be sent shortly. So you can see that here. The annual review blue means pending. They're a January birth month, so if this wasn't a test patient, they probably would have been invited by now. And I can click record in the notes. It will give a bit of free text. It'll also add some codes. Those codes let us kind of check that the protocol is being used, but also identify if they've been used repeatedly and the patient's never actually moving into the next steps. Ideally, what the system then will do is it will bring the patient in, they'll have their annual review, have everything up to date, and then most of the time they'll be sent a medication review questionnaire. That would be sent by Comms Annex, and they can complete that themselves. And I'll just show you briefly what that looks like. It's based on the drum questions, but rather than simply asking, for example, this is a good one, side effects, do you have any side effects? And saying, yes, okay, we need to speed to them. They've actually got two options. So it might be, yes, they're manageable, I don't need to discuss them, in which case that's fine. Or, yes, and I want to discuss them. And you can see here that's adding that signposted GP pharmacist. So if any of their answers in any of these are this kind of I want to discuss, then the flow is that they would get texted a link to book in for a review with a pharmacist. Or it might be that you send a letter, up to you how you do that. But we find that about 80% of the time, patients give answers that suggest that everything's okay. So you can see this one signposting to community pharmacy, because actually for some of these things, it's appropriate for community pharmacy to support the patient with. So let's say the patient's had their review, we save that. We can then see their answers here. And the patient would then fall into a report for a pharmacist or a GP to review the medication. And in that scenario, rather than kind of things that are due, there'd be lots of green ticks to show everything's up to date. There are some warnings here, like compliance, because this is a test patient. She doesn't order her meds very often. There'll be things like if there's QOF indicators to consider, that would appear there. And when this is flowing well, what pharmacists and others find is that they can do perhaps 20 to 30 med reviews safely in an hour, because the system's doing lots of the checks for them. And there's even this button here, look, record notes-based med review. So this is picked up about the compliance. So it might be that actually the medication's PRN, and so compliance is appropriate. But it will kind of put together what information have we got, not working brilliantly well for this test patient, but it might say things like they've completed a questionnaire, everything's up to date, med review done. So that both enables a really safe and efficient notes-based med review. Even if patients don't respond to the questionnaire, they've obviously had the chance to do that. And if they do respond and their answers show they need to review, that's fine. That's where they'd go. Equally, it may be that when you or someone is reviewing the meds here, you think, no, we do need to speak to them, if you just simply were to click that button, it will drop them out of the list for review, and instead, pause that one, it will record that they need to speak to someone. A few other things to show you. There's lots more to the module, but that's the kind of key bit about that flow, and it integrates with the recall system. But there are also other checks. So this patient is on a Pixaban, so a DOAC that needs at the least 12 monthly using these. If I try to issue this, so a few things. First, it's asking me how the patient ordered their meds. Optional whether you have this, but it means we can get really useful data on how patients are ordering. If it puts a paper or phone, when the system goes to then text them to say your meds have been issued, it will add into that note, please consider ordering online next time, and here's how you can do that. But before it's got to this point, it's flashed up with this, which is actually stopping that message from going. So high-risk drug needs manually reducing to fortnightly due to monitoring being overdue unless the patient books now. Now, what CQC will say, and this is sort of feedback from various inspections, that it's great that you're inviting the patient lots for their annual review, for their med monitoring, but if they're not attending, you need to be doing more than that. You need to be actually restricting the supply of their medication. Now, practices vary a lot with this, in my experience. Some don't do this at all. Some, it's really labour intensive, so it's lots of tasks to individual GPs, and then what happens is really variable as well. So there's options here to book now, or to task someone to reduce the script if the person doing it isn't themselves confident and trained to do that. But by doing this, it's safer and it's consistent. And as I expect you'd imagine, when patients have their medication reduced to fortnightly, they're pretty good at getting in touch and booking in. So it helps overall provide a safe way to prescribe and manage people's medications. There's other things you'll pick up here, like DOACs needing alert cards. Some of these are optional. If you don't want them, that's fine. There are other safety checks as well, like if I were to add a different DOAC, it would point out that the patient's already on one. There's things about helping to follow the opioid prescribing ladder, warning patients of risk of addiction for opioids and benzos and things like that. So lots of safety things. We've not developed it fully yet or published it yet, but the system will also include systems for flu vaccines and how that works. It might work to show you on this test patient. But essentially what this does is it identifies any things of concern regarding flu jabs, and there's a whole process to bulk add PSDs to give them safely and rapidly in a clinic. That's still to come, but the prescribing stuff itself, the big real win is on safe notes-based med reviews and massively reducing all the tasks and queries that you get about medication where staff don't really know what to do. And so you end up with masses and masses of unnecessary work. If you want to know more, as always, do get in touch. Happy to meet with you, give you demos, explain more, and answer any questions you may have. Thanks.